That day started off normal. I worked traffic south of Eureka. Went home at about noon for a lunch break, and then I was called out by Deputy Heinz to assist him in looking into some suspicious activity. And then the incident happened. I exited my patrol vehicle and could see the Deputy Heinz had exited him. We began approaching towards the suspect vehicle when it reversed out of the ditch that it was stuck in and came at me up Camp 32 Road.
It was a typical day. We were dispatched to the Eureka area, to the Kootenai area for a person that was struck by a motor vehicle.
Seeing the vehicle come towards me, knowing that there was no cover to my left or to my right, and the time, there wasn't enough time for me to get out of the way with the road, with the weather conditions, the snow on the ice on the road. Realizing that I was going to get hit, I kind of decided it was time to figure out if I was a superhero and just leaned into it with my shoulder.
In that situation, you usually figure that somebody's probably going to be significantly injured. So we left what we were doing over at the hospital, came over here, got our gear, and loaded up.
There is what we call the trauma golden hour. And really what that is a timeline where we want to be able to identify injuries, start treating injuries, and have them arrive at our hospital so we can start care. So in his case, he had significant injuries, and it was imperative we get him here right away.
You think of things that potentially could be wrong, what type of injuries they could have. It can vary from very extreme to nothing, all dependent on how they were run over or what type of vehicle ran them over. There's always those factors to put in, and you don't know those until you get there.
The potential for life-threatening injuries is very high in a situation like this. And you want to be able to get him to definitive care as quickly as possible.
We pulled in as A.L.E.R.T. helicopter was landing. So I knew it was not good. Having been a trooper and worked dozens and dozens of crash scenes, we don't call A.L.E.R.T. when people break their elbow.
So we get in the back of the ambulance, we get a full report from the ambulance crew as to what's going on, what they know about him, what happened, and then we do a full physical assessment of him. On our physical assessment, it was noted that he had some crepitus, which is kind of a crunching sensation when you feel it in his rib cage. And we did notice that he wasn't moving his lower extremities.
And he just had all of these abrasions across his face, and he was reddish purple and like pine needles, and they had his shirt off, and he had just this rash, like the road rash, going across his torso, and he was just laying there, but talking. I didn't understand the severity of his injuries at that time.
So his biggest injury was that he had sustained what we call a fracture dislocation of his spine. And unfortunately it resulted in loss of function of his legs or paraplegia. He had rib fractures, he was having some trouble breathing, he had a dislocated shoulder, he had some other extremity fractures, and some lacerations that just needed some temporizing treatment.
On the flight in, he was literally sitting right here. I sit right at the patient's head. Our primary deal was to monitor airway, blood pressures, and his vital signs, his level of consciousness and such, and to do some pain management for him to try to make him a little more comfortable for the trip into the hospital.
having access to us and getting them back to a higher level of care is an absolute need up there.
The whole trauma team was there and waiting for us when we walked in the door with him. Got him moved over onto the ER cot, gave a full report to the trauma team, and the trauma team pretty much just took over at that point.
My last memory after the helicopter lands is just the line of support, troopers, deputies, officers, from the helicopter pad to the emergency room doors. The level of care that I received at Logan Health was outstanding. I was here for 9 days, and then on the 28th of February I was flown out to Craig Hospital in Denver, Colorado.
Early on, there was discussion that Lewis needs advanced spinal care and a rehabilitation center, and Craig Hospital was mentioned. And then this discussion arose of flying to Colorado, how he would get there, and A.L.E.R.T was suggested, and that was it. Leon and Reese have to fly us. They have to be there.
That was a powerful experience to have. You know, I don't even remember how long it was, the procession of police vehicles with lights on. And then to see them all lined up at the airport as they loaded me on to the plane and got me comfortable, and I could see everybody out the window.
We heard through the grapevine that the Johnsons had actually requested that Leon and I be the ones to fly him down to Denver, which that was, you know, that kind of makes you puff up a little bit that somebody actually requested you to do that. That was pretty special for both of us.
Even if we can't keep them here in Kalispell, it's nice to know that you have a program that can get them to where they need to be.
I think what people don't recognize with A.L.E.R.T is that they are really an extension of our hospital. These are individuals who constantly look for ways to improve their care and opportunities to better treat the patients in our community. They're dedicated to it.
You know, communities need us. They need us to transport those patients to a higher level of care.
There was a level of comfort knowing that A.L.E.R.T was coming, just obviously due to the nature of their profession, they can get you to that next higher level of care quickly.
You know, you do your best to give the best care you can to every patient that you have, but there's something in there that just kind of, that little twinge in the back of your mind when it's actually somebody that's close to somebody that you're acquainted with and have a working relationship.
It's family. It's like your family. You know, law enforcement, fire, EMS, you're all family.
They kept our family together. That means the world to us. Yeah, that's something I am forever grateful and thankful to them for.